RRB Railway Recruitment Staff Nurse 2020-2015 paper. Question number 1. Mode of transmission of pertussis. Option A vectors, option B through contaminated water, option C droplet infection, option D fecal-oral. So option C is the right answer. Droplet infection. Pertussis is also known as whooping cough. Is a highly contagious respiratory infection caused by the bacterium modality pertussis. Pertussis spread easily from person to person, mainly through droplet process by coughing, sneezing. This droplet does not travel very further through the airway and usually only infected person nearby. Vaccination is the best way to prevent the pertussis. Vaccination against pertussis is a part of the regularly recommended childhood vaccine. Pertussis is a vaccine booster is also recommended for adolescent and adult. Second question. Time requirement measurement of Montague test. Option A 24 to 48 hours, option B 48 to 72 hours, option C 10 to 12 hours, option B 2 to 4 hours. Montague tests are 48 to 72 hours in time in measurement. Option B is the right answer. Time requirement of measurement of Montague test is the 48 to 72 hours. The Montague test was first developed and described by the German physician Felix Mendel in 1908. It is a name of Carolus Montague. The Montague test is a tool for the screening for tuberculosis, TB, and for the tuberculosis diagnosis is also known as Montague screening test. Tuberculosis sensitive test, prequest test, peripheral protein derivative (PPD), purified protein derivative test. Third number question. Name of the oral polio vaccine. Option A BCG, option A TAB, option C SLAG, option D Cybin. Option D Cybin. Name of the oral polio vaccine. ओरल पोलियो वैक्सीन का नाम क्या है? तो साइबिन. Name option D is the right answer. Name of the oral polio vaccine. The trivalent of the oral polio vaccine Topiv. It is also called as a Cybin vaccine. Polio vaccine are the vaccine used to prevent polymyelitis. OPV produce antibody in the blood to all three types of polio virus, and in the event of the infection, this protect the included against polio peripheral by preventing the spread of poliovirus to the nerve system. BCG is vaccine for tuberculosis, TB and disease. BCG is bacillus gluconate and chlorine. Question 4. 2000 RRB 2015 paper solution. The following are the standard tuberculosis during except ट्यूबरकुलोसिस इनमें से एक है वो गलत है। क्लोरोमाइसिन स्ट्रेप्टोमाइसिन INH के पास। ऑप्शन ए क्लोरोमाइसिन इज अ रॉन्ग। ऑप्शन ए क्लोरोमाइसिन इज अ राइट आंसर। स्ट्रेप्टोमाइसिन INH and pass is also tuberculosis drug. Option A chloromycin is a not standard tuberculosis drug which is help to in the treatment many type of bacteria infection. Tuberculosis is an infection disease caused by the mycobacterium tuberculosis. The basic symptoms of the tuberculosis are cough for more 3 weeks, fever and fatigue, chest pain, etc. Question 5. Combination of triple antigen. ट्रिपल एंटीजन નું કોમ્બિનેશન क्या है? ऑप्शन ए DPT, ऑप्शन बी BCG, ऑप्शन सी TAP, ऑप्शन डी ECG. ऑप्शन ए DPT is the right answer. ट्रिपल एंटीजन ऑप्शन DPT is the right answer. Is a combination of triangle triple antigen and triple antigen. DPT vaccine protect against three diseases: diphtheria, tetanus, and pertussis of whoop coughing. Diphtheria and tetanus are caused by bacterial toxin. Inactivation of the bacterial toxin produce two toxins that are no longer toxic but maintain the antigenic proxies and are the used as vaccine. Bacillin calumet glucurin is a vaccine for the tuberculosis disease. TB is combined vaccine used to produce immunity against the disease. Typhoid, paratyphoid A and paratyphoid B. The time of interval between infection of the suspected person and appearance of the sign and symptoms of the disease is called option A quarantine, option B recovery period, option C incubation period, option D isolation period, option C incubation period. The time of interval between infection of suspected person and the appearance sign and symptom of this is called the option C incubation period. The time and interval between infection of the suspected person and appearance of the sign and symptom of the disease is called the incubation. The incubation period is also called the latency period. The first known as of the term incubation period was 1872. Example: the incubation period the chickenpox is for 40 to 16 day time period. For chickenpox eggs to hatch is a incubation period. The time of interval between infection suspected person and appearance of sign and symptom of the disease is called option A quarantine, option B recovery period, option C incubation and option D isolation. Option C incubation is the right answer. Option 7. Route of transmission of hepatitis B: oral, potential, fecal-oral. Option D contaminated water, option B potential. Route of transmission of hepatitis B is potential. Hepatitis B is the most common liver infection of the world. It is transmitted by blood through unprotected sex and during the pregnancy or childbirth. Hepatitis B is a sign and symptom may include dark urine, abnormal pain, fever, loss appetites, nausea and vomiting, etc. Extra, it caused by hepatitis B is HBV virus. Hepatitis B virus is HBV. The hepatitis B vaccine is typically given as two injections separated by a month of 3 or 4 injections over the 6 month of depending on which vaccine is given. Mode of transmission and typhoid fever. Option A intravenous, option B facial, option C respiratory, option D droplet. Option B facial. Mode of transmission facial. Typhoid and paratyphoid fever are the caused by the bacterial Salmonella typhi and Salmonella paratyphi respectively. Typhoid or paratyphoid fever are transmitted via facial oral route and causative bacteria are passage in face and urine of infected people, which may contaminated food and water beverage and cause infection. The consumer of the such contaminated food. Typhoid fever, also called as entered fever. The two main symptoms of the typhoid fever and rush and two symptoms are diarrhea, nausea, bloating, weakness, headache, and it is extra. The only effective treatment for typhoid antibiotics. Causative organs of diphtheria. Option A mycobacteria, option B streptococcus, option C chronic bacteria diphtheria, option D Staphylococcus, option C Cronibacterium diphtheria, option C. Diphtheria is a serious infection caused by strain of bacteria called chronic bacteria diphtheria. The make a toxin. It is the toxin that can cause people to get very risk diphtheria. Bacteria spread from person to person visually through the respiratory droplet like from causes of sneezing. The disease is more common in children. Running nose, sore throat, fever, and symptoms of diphtheria. But the formation of membrane in the throat is a main symptoms. DPT vaccine is available to prevent the disease. Incubation period of measles. Incubation period 1 to 7 days, option B 7 to 14 days, option C 40 to 21 days, option D 21 to 28 days, option B 7. Incubation period of measles में incubation period 7 to 14 days 7 से 14 दिन का होता है. इंक्यूबेशन पीरियड मीजल का 7 से 14 दिन का होता है. इंक्यूबेशन पीरियड ऑफ मीजल 7 to 14 days. The incubation period is of the disease refer to the time between contact with the carrier of the disease and development symptoms. Measles is an infection disease caused by virus. It spread easily for the person and another. It is also called rubella. It causes divided into 4 shapes: incubation phase, prodromal phase, rash phase, and recovery phase. 11. Question 11. Site of Montes test. Option A outer and upper coordinate and glutex maximum. Option B dilated region. Option C, posterior left forearm, and option D, anterior left forearm. So option D is the right answer. Site of Montague's test, anterior left forearm. Montague's test is also known as tuberculosis skin test. The PPD test is used to diagnose the latent and asthmatic tuberculosis caused bacteria. The Montague's test is usually applied on the middle third of the thorax surface of the forearm, as reaction may be weaker near the wrist of the elbow joint. Is usually applied on the left forearm. Use first 1 ml syringe of the aspirate out of 0.1 ml of PPD RT23. 12 question RRB 2015 question paper. Media of transmission of the bovine type of tuberculosis. Option A, milk. Option B, water. Option C, air. And option D, food. Option A is the right answer, milk. Media transmission bovine. Bovine means bovine tuberculosis bacilli. Option A, right. Option A is milk is the right answer. Media of the transmission of the bovine type of tuberculosis bacillin is milk. Bovine tuberculosis (TB). Bovine tuberculosis is a type of TB that can affect animal as a cattle's and deer, and some exotic animals such as rhinoceros. In non-human primates, bovine TB is by the bovine TB. They are animal TB. Bovine TB are the animal TB. This is of milk. This is human body in secret the main cause of milk. Bovine TB caused by the bacterial Mycobacterium bovine, which is a very similar to bacterium that is usually cause of human tuberculosis. Bovine TB can also affect human. Transmission of the bovine TB of the infected cattle human occur primarily through consumption of the raw milk of the raw and milk product containing the bacterial. Transmission can cause also occurring through prolonged exposure of the bacteria in the air in the immediately vicinity of liver infected cattle of their characteristics. 13. Painful maturation. Option A, insuresis. Option B, diuresis. Option C, retention of urine. Option D, diarrhea. Painful maturation is a option B is the right answer. Dysuria. Dysuria is the cause of painful urine. It is the medical term for the pain for discomfort when you discomfort from urinating often of the described as burning sensation. Burning sensation. Dysuria most commonly is caused by bacterial infection of the urinary tract. Depending on the cause of dysuria, there may be other Symptoms are painful urinary incontinuously strain will urinating etc. Dysuria is a disease in any woman of men. The risk of the getting infected with the equal and dysuria is due to the some type of infection. The antibody are the use in this situation. Amount of solution used for equivalent anemia is adult. Option A 100 to 250 ml, 250 ml to 350 ml, 500 to 1000 ml, 1000 to 1500 ml, 100 ml से 250 ml. ऑप्शन बी 250 से 350 ml. ऑप्शन सी 500 ml से 1000 ml और ऑप्शन डी 1000 ml से 1500 ml. ऑप्शन सी 500 से 1000 ml जो अमाउंट ऑफ सॉल्यूशन यूज इवैक्यूएट एनीमा इन एडल्ट 500 से 1000 ml. ऑप्शन सी इज द राइट आंसर. Amount of solution used for relevant anemia in adult 500 to 1000 ml in anemia is a liquid prescription that is introduced into the body via the recruitment for the purpose of production and bowel movement or the administration medication. Anemia is classified into the evacuate anemia and retardation anemia. Evacuate anemia is used to the eliminate difference gas distension and also to increase the water content which is the present in the stool. And retardation anemia is usually used in the stroke of collapse and some position area. Drug relevant pain. Option A anti-inflammation, option B antipyretic, option C antibiotic, option D analgesic. Option D is the right answer. Analgesic. Drug use relevant pain. Analgesic are the medicines that are used to relieve pain. They are also known as painkiller or pain relieving. Analgesic drug can be sold as an over the counter of prescription drug. Analgesic drug can be classified of non-opioid drug or opioid drug and analgesic drug. Non-opioid and analgesic drug included acetaminophen and NSAIDs. Opioid is also known as narcotics included natural substance. Example is morphine, semi-synthetic etc. Cholinergic medicine are the drugs that have primary use other than pain relief but also help improving analgesic for some painful condition. Thank you for watching and subscribe my YouTube channel. Please following and share and subscribe. Thank you.